Hi everyone. Today I'm going to share about chronic pain and the effects it has on mental health. First of all, I'd like to talk about what pain is. Everyone at some point in their lives feels pain, and it's the body's way of communicating that something is wrong. In normal circumstances, pain can be a good thing. When an injury occurs, such as touching a hot stove, the nervous system triggers a series of electrical signals from nerve to nerve until it reaches the brain. The brain processes the signals and sends out the message of pain. Pain is a protective mechanism within the body to help the person to stop what they're doing so that further injury does not happen. In the case of the hot stove, the person reacts by pulling their hand away. Pain is a universal experience and is a vital part of being human. Pain tells the person that there's a problem within the body that requires further investigation to find the cause. So, for example, chest pain, it may be the cause of a possible heart attack, or jaw pain may be a sign of an infected tooth that needs to be pulled. Pain is not supposed to last for a long period of time, and it should be something that stops after an injury is healed. A couple different types of long-term pain are acute pain and chronic pain. Acute pain is pain that lasts no more than 3 to 6 months. Chronic pain is pain that continues past 6 months and persists even when there is no explanation as to what is causing it. So, putting it simply, chronic pain or persistent pain is pain that continues on a daily basis when it should not. There could be a number of injuries and underlying health issues that are common to cause chronic pain, such as a neck injury or back injury, migraines, arthritis, cancer, or various types of autoimmune diseases. Living with daily pain affects the person not only physically, but also mentally. Chronic pain increases the levels of stress hormones in the brain, which causes a chemical imbalance within the body. The imbalance increases the likelihood of mental health issues such as depression and anxiety to occur. Chronic pain interferes with a person's everyday life, making it difficult to do just ordinary tasks, enjoy previous hobbies, exercise, and may also disturb sleep dramatically. Chronic pain is one of the most common reasons that people seek medical care. It has been tied to limitations in activity, dependence of opioids, mental health issues, and a reduced quality of life. Research has shown that those with chronic pain are 4 times more likely to have a depression or anxiety than those who are pain-free. Approximately 50 million U.S. adults suffer from chronic pain. Health economists have reported the annual cost of chronic pain in the United States is as high as $635 billion a year, which is more than the yearly cost for cancer, heart disease, and diabetes. Patients with moderate pain pay $4,516 more in annual health care costs than those with no pain. Patients with severe pain pay $3,210 more in annual health care costs than those with moderate pain. Sometimes diagnosing and treating pain can be a difficult and a long journey because pain is a subjective experience for each person. There is no test to measure and locate it precisely. The most common treatment for chronic pain are medications, which range from over-the-counter pain medications such as acetaminophen to much stronger and addictive medications such as opioids. The long-term use of opioids can increase the chance of becoming addicted to them, which can threaten the person's health and well-being even more. Approximately 21 to 29% of patients misuse opioids prescribed for chronic pain. Misuse of prescription opioids causes 17,000 overdose deaths annually. People with chronic pain have at least twice the risk of a suicide than those without chronic pain. Many people who have chronic pain are also taking antidepressants because they may relieve both pain and depression because of shared chemical messengers in the brain. Some other forms of treatment that are helpful for chronic pain are talk therapy, journaling, visual therapy, art therapy, prayer, meditation, and yoga. It's also helpful to eat an anti-inflammatory diet, reducing sugar and alcohol intake. Normal sleep patterns are often disrupted when a person has chronic pain, so any forms of relaxation before bedtime can help. This is when meditation or journaling may be most helpful. There are physicians who specialize in pain management and help the patient find the resources and support they need for a better quality of life. There are also therapists who work with clients in this specific area, helping them create a game plan to cope with the pain and also work on any underlying trauma that may be a contributing factor to what is called somatic symptom disorder. And this is a disorder where there is no real explanation to the chronic pain the person's experiencing, but first working through the past trauma, finding healthier ways to cope with stress, and just learning how to change old negative thought patterns to more positive ones can significantly help the person heal and possibly alleviate some of the chronic pain. It's helpful for someone who is in chronic pain to have a good, strong support system of doctors, counselors, friends, and family who can just be a sounding board and an encouragement to them. Just having someone who will listen and just be there for them and when the days are rough can really make a difference in someone's life with chronic pain. So I chose this topic because chronic pain is something that I've personally battled with for almost 4 years. And I was living a pretty normal life without any limitations, and it basically just hit me out of the blue. The joints in my hands and feet swelled, and at one point I could hardly walk. So after seeking out treatment from various doctors, I was told that I have an autoimmune disease and that the best option would be medication. But to me, the side effects of the medication were much more scary than the diagnosis of the autoimmune disease. So I chose to seek out alternative treatments such as cryotherapy, ozone therapy, acupuncture, chiropractic care, essential oils, herbs and supplements, yoga, and meditation. I'm also taking an alternative medication called low-dose naltrexone that helps boost the immune system and lowers inflammation. I've found that good self-care is absolutely necessary. I see a therapist once a week. I exercise every day. I've also eliminated sugar, gluten, and dairy from my diet. And I'm happy to report that within the past 6 months, my pain levels have decreased dramatically, and I would say that I am about 95% better than I was a year ago, so which is amazing. And it's been a long journey with some rough days, but with persistence and being open to trying different things and having a great support system around me has made such a huge difference. Thank you for watching my video and have a great rest of your weekend.